Welcome to today's video, where we're going to simplify a very important topic, diabetes. Millions of people live with this condition, yet many still don't fully understand what it really is, how it affects the body, and the key differences between type 1 and type 2 diabetes. So, whether you're here for yourself, a loved one, or just to learn something new, this video is for you. Let's break it down clearly, simply, and in a way that actually makes sense. What is diabetes? Diabetes is a chronic health condition that affects how your body processes blood sugar, also known as glucose. Now, glucose is the main source of energy for your body's cells. It comes from the food you eat. After a meal, your body breaks down the carbohydrates into glucose, which enters your bloodstream. In response, your pancreas, a small organ behind your stomach, releases a hormone called insulin. Insulin acts like a key. It unlocks your cells so that glucose can enter and be used for energy. But in diabetes, this process doesn't work the way it should. Either the body doesn't make enough insulin, doesn't make any at all, or the cells stop responding properly to insulin. The result? Too much glucose stays in the blood, leading to high blood sugar levels, which over time can cause serious damage to the body. There are two main types, type 1 and type 2 diabetes. Let's explore each one. Type 1 diabetes. Let's start with type 1 diabetes. Type 1 is an autoimmune condition. This means the body's immune system, which normally fights off bacteria and viruses, mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the body can't make insulin at all. Without insulin, glucose has no way of entering the cells, so it builds up in the bloodstream. Type 1 diabetes often develops quickly and suddenly, and it's usually diagnosed in children, teenagers, or young adults, though it can happen at any age. It is not caused by lifestyle or diet. It's not anyone's fault. It's believed to be linked to a mix of genetic and environmental factors. Because the body can't produce insulin, people with type 1 diabetes must take insulin every day, either through injections or an insulin pump, to stay alive and healthy. Symptoms of type 1 diabetes often appear quickly and may include excessive thirst, frequent urination, extreme hunger, sudden weight loss, blurred vision, weakness or fatigue, mood changes. Without treatment, type 1 diabetes can become life-threatening. But with proper insulin therapy, blood sugar monitoring, and healthy habits, people with type 1 can live long, active, and fulfilling lives. Type 2 diabetes. Now let's talk about type 2 diabetes, the most common form of diabetes. In type 2 diabetes, the body still produces insulin, but either not enough or the body's cells become resistant to it. This means insulin can't do its job properly, and glucose can't enter the cells as easily. Over time, the pancreas struggles to keep up with the increased demand for insulin, and blood sugar levels rise. Unlike type 1, type 2 diabetes usually develops gradually, often over many years. It's more common in adults over 40, but it's now increasingly being diagnosed in younger adults, teenagers, and even children. Type 2 is strongly linked to lifestyle factors such as being overweight or obese, poor diet high in processed foods and sugar, lack of physical activity, smoking, chronic stress, family history of diabetes. Symptoms of type 2 diabetes can include increased thirst, frequent urination, fatigue, blurred vision, slow healing of wounds, tingling or numbness in hands and feet, frequent infections. Some people have no symptoms at all and may only discover they have diabetes during a routine checkup. The good news is, type 2 diabetes can often be prevented or delayed through healthy lifestyle choices, like eating a balanced diet, staying active, maintaining a healthy weight, and managing stress. The impact of high blood sugar. So, what happens if blood sugar levels stay high for too long? High blood sugar, also called hyperglycemia, can damage blood vessels and nerves throughout the body. If left untreated, diabetes can lead to serious complications such as heart disease and stroke, kidney failure, vision loss and blindness, nerve damage causing pain, numbness, or even amputations, skin problems and poor wound healing, increased risk of infections. This is why early diagnosis, consistent monitoring, and effective management are so important. How is diabetes diagnosed? To find out if someone has diabetes, doctors can run a few simple tests. Fasting blood sugar test measures blood glucose after not eating for 8 hours. HbA1c test reflects average blood sugar levels over the past 2 to 3 months. Oral glucose tolerance test measures how your body processes sugar after drinking a sweet liquid. Random blood sugar test measures sugar at any time of day, regardless of when you last ate. Depending on the results, you may be diagnosed with prediabetes, a warning sign that your blood sugar is higher than normal or full-blown diabetes. Other forms of diabetes. While type 1 and type 2 are the most common, there are a few other types worth knowing about. Gestational diabetes. This develops during pregnancy and usually goes away after birth. However, it raises the risk of type 2 diabetes later in life. LADA, latent autoimmune diabetes in adults. Sometimes called type 1.5, this is a slow-progressing form of autoimmune diabetes diagnosed in adults. MODY, maturity-onset diabetes of the young. A rare, inherited form of diabetes caused by a genetic mutation. Each type has its own causes, risks, and treatment approaches, so proper diagnosis is essential. Living with diabetes. Living with diabetes requires daily care, but it doesn't have to stop you from living a full and happy life. Here are some key elements of diabetes management. Monitoring blood sugar levels regularly. Eating a balanced diet with whole foods and controlled portions. Staying physically active. Taking medications or insulin as prescribed. Managing stress, sleep, and mental health. Visiting your healthcare provider for regular checkups and screenings. With education, support, and the right tools, many people successfully manage diabetes and even reverse some of its effects, especially in type 2. So let's recap. Diabetes is a condition that affects how your body handles blood sugar. In type 1 diabetes, the body doesn't make insulin at all due to an autoimmune attack. In type 2 diabetes, the body becomes resistant to insulin or doesn't produce enough. Both types require lifelong attention, but with the right knowledge and actions, people with diabetes can lead vibrant, healthy lives. Thanks for watching and learning with us today. If you found this video helpful, don't forget to like, share, and subscribe for more easy-to-understand health content. And remember, your health is your wealth. Keep learning, keep growing, and take care of yourself every single day.